When this administration came into office, we had a production capacity of about 1765 megawatts. Now, if you average that over 50 years, you are looking at a contribution of about 35 new megawatts onto the grid every year. In the last 2.5 years, we've pumped through 675 megawatts. That's giving you an average of 200 megawatts of power every year coming onto the grid. You're looking at a six-time increase, basic 600% jump in power supply onto the grid. Now, the overall vision of taking our generation capacity to 5,000 remains. But will we get to 5,000 by 2017? Highly unlikely. But are we getting into a situation where we are now producing more than we consume? Yes. For the first time in many years, Kenya is in an energy surplus position because we are now at 2,319 megawatts production, right? And we have a pent-up demand of about 200 megawatts less. If you look at that, that space of unutilized power, many might say, then why do we want to get to 5,000? But the explanation is actually very simple. If you look at the last mile, only 50% of Kenyans' households are connected to power. So we need still to connect another 4 million Kenyans to the grid. That will soak up the power that we need. If you talk to His Excellency President Kagame today, he'll tell you he's waiting for Kenya to supply to him at the very minimum 30 megawatts. His real aspiration is to pick up 215 megawatts from us. If you look at the government of Tanzania, their power projects are now lagging significantly behind schedule. They were hoping to get LNG power coming on stream. They wouldn't get it. So Kenya has significant market both domestically and within the region to export any excess power that it generates. So I'm quite confident about this. But for governors, I need to raise a couple of issues. Our shift from reliance on hydro and thermal energy of necessity requires that we invest in geothermal, of where we have the most potential, and wind energy and solar energy. Now, to date, we have a number of projects that are very successful, and we have others that are train smashes. And we have them as train smashes because the stakeholder engagement at county level is not what it should be. These projects are not national government projects to the exclusion of the county. For you to achieve your objectives, you need this power to come to you. But the power is not going to be generated necessarily in your county. Now, if I take an example of Loyangalani Turkana wind, I have 310 megawatts coming on stream in January 2017, ready for distribution. But the county government of Nyandarua has blocked access for us to pass our 90 kilometers of wayleaf through your county. We need it so that we can supply every governor here with that power. If I look at the power generated at Olkaria 4, we have 280 megawatts that is sitting in Menengai because the county government of Kajiado has refused us to take that power to Makueni and to Mombasa. We need you to give us access. We need you to talk to your constituents. We need you to help facilitate the conveyance of this power because the generation capacity will happen, but we must be able to get it to all the Kenyans that require this energy. Your Excellency, I'll beg your indulgence because I said I'll use this forum to really drive the agenda that is blocking our delivery schedule, which is stakeholder engagement. Tell us how we can help deal with compensation issues. Tell us how we can help deal with educating the public on the health concerns they may have on wind turbines. You know, if I take Meru County government, for example, land that was worth 500 bob, 1,000 bob an acre 3 months ago, because we now have a 50 megawatt wind project planned there, the land price has gone berserk. And we now have a meeting on the ground with KenGen, I think on Friday, Your Excellency Governor, to try and resolve this issue. But it's an artificial issue that has been raised by mismanaged expectations on the ground. Now, this threatens our regional competitiveness. If we are not able to generate this power on time and effectively, it will not matter whether we have 2,000 megawatts or 5,000 megawatts. We need costs that will come down to at least between 13 and 14 US cents for us to compete with Egypt, for us to compete with South Africa, and for us to compete with Ethiopia, which by the way will have a surplus of power within a year or two. we have added 2.1 million people onto the grid from March 2013 to date. Now, that is unprecedented since the independence of this country. Now, we hope to get to a 70% penetration rate by 2017. Now, this project is funded both by Exchequer and through external support. But it's very important that at the county level, we cannot get this penetration. We will not get your constituents to have power in their houses unless we deal with the distribution and allowing KETRACO to do its work and allow them through your jurisdictions so that they can distribute power to your constituents, facilitate industry, capacitize your institutions to be able to do what they generate best. I think, Governor Malombe, you talked about the economic contribution of your specific counties to the GDP. You will do nothing unless you have affordable power. And for you to have affordable power, you have a coal plant sitting in your county. If we cannot evacuate the power from Mui, we will not be able to do it. If we cannot evacuate power from Lamu County, for Amu Power today, who are struggling to deal with stakeholder issues, we will not be able to contribute to the overall reduction of power costs in this country. As we speak, we have added 25,527 new street lights across various counties. As of yesterday, there was an agreement with Kenya Power and Lighting to extend this project to 52 more towns across various counties. I'll put that up there for your review. But these range from all the way from Peketoni to Wajir, Kitengela, to Kutus, to Gilgil, to Kikope. So there's no question of selective, when we are looking at the locations, no one can paint a political brush on it. I think as far as possible, this is as equitable as it gets. But again, just to be reminded that this is something that is being done over and above the national government's commitment for power and power management. I had not included this in my PowerPoint presentation, but I just want to touch on something called fast oil. Many people think the oil in Kenya is a mythical product. It is real. We have 600 million barrels of oil sitting and awaiting to be evacuated. As we stand now, we are looking at all options of whether to move this oil on petroleum through our regional engagement with the government of Uganda, or to move this petroleum on our own, even as we look at building the pipeline from Hoima, Lokichar, through to Lamu. And as we speak, work has been done to improve the road network from Lokichar to Lodwar and from Lodwar to Kapenguria to increase the shoulder size to allow trucks which carry crude oil petroleum to convey that petroleum through to Kitale and subsequently to Eldoret. From Eldoret, RVR has been contracted to move this all the way through to Kipevu. As we speak again, we are now trying to do work to refurbish Kipevu to allow Kipevu to take petroleum out. It has only been bringing petroleum in. Now we want petroleum in crude form to go out. They do what they call fast line refinery and then take that into the export market. We are quite ambitious, but we know we'll be able to pull this off in the next 12 to 16-month window. Isolated 3 areas for the President's flagship agenda. One is managed equipment services, which has been discussed at length in this session. The second is the free maternity subsidy that is issued by way of conditional grant to the county governments. And the third is the urban slum upgrading medical project. Now, to start with the managed equipment services, there was quite a new way of doing things where the government went into a managed list service arrangement with medical service, equipment service providers in order to extend the reach of medical services. When you talk to the president and the deputy president about their vision for healthcare, it's one, that no Kenyan should be more than an hour away from a basic healthcare facility. And this will have to happen at various levels, dealing with our referral institutions, dealing with our level 4, level 5 institutions, dealing with our healthcare centers, and dealing with clinics at the grassroots level. The managed equipment services has gone towards, first of all, creation of an ICU facility in 11 hospitals, creation of a renal facility in 49 of the 98 targeted hospitals, radiology facility. If Governor Mutua was here, he would tell you about the queues that form at Machakos General Hospital from 5 in the morning because he has the first working dialysis machine in a public institution outside of 100 kilometers in the center of this country. Many of your hospitals had many of your hospitals have dialysis machines that are sitting in rooms because they're not working. You don't have clean water facilities, you don't have the renewable parts. But this initiative has largely started to have impact where we have signed. So you do have Kakamega ready, Homa Bay ready, Machakos already in use, and Thika coming, this is Kiambu County, coming on stream shortly. None of this would happen without the support of the governors on the ground. You look at theater and theater sterilization as another initiative. 96 facilities are set to be equipped. 16 sites have been commissioned as we speak. This is perhaps not moving as quickly as we want it to move, but just to put it into context, this country loses every year 3,000 people to road traffic accidents. Majority of those deaths are the time between the accident and the access to a medical facility. And this has to be cut down by removing the over-reliance on Kenyatta National Hospital, Moi Referral Hospital, and being able to get people into ICUs and places of treatment as quickly as possible and as close as possible to where they live or where those accidents have occurred. And that was the reasoning behind the theater and the ICU facilities that have been spread. I'll now want to talk to the maternity, the free maternity program. And one of the thoughts I had yesterday when we were having the debate on the conditional grants on free maternity is that I think we would have talked about this issue much less if we had at least 3 or 4 women governors, because the issue of maternity is something that we cannot debate in empirical terms. You know, it's something that is a non-negotiable commitment by any government to its people. And this has been perhaps, however troubled the beginning, has been extremely successful. When this administration came into power in 2013, there were only 600,000 mothers delivering in public health facilities. Today, as we speak, that figure is double what we found. We are now roughly hitting about 1.2 million mothers going into public health facilities. The work on computing the mortality rate for mother and child is something we'll be able to share later in the year when the surveys are complete. It's a statistic that is collected every 5 years, and I don't want to be a charlatan and guess a figure, but we will have that figure and share it later on in the year. But many of you will testify, and your constituents will testify, that they can now have some dignity to their pre- and postnatal care, and that is something we owe every mother. The last component on the health services is the slum upgrading program. Again, it's a question of thinking out of the box. Some of these people, you cannot get them into the medical facilities. So let's unbundle the medical facilities and take it to them. And I would like to extend on behalf of the Ministry of Health our thanks to Governor Kidero for allowing us to pilot this within Nairobi County and specifically in Kibera, where we've rolled out 9 of these modular clinics which are contained in containers. They have medical officials, some seconded from the national government and some seconded from the county government, and drugs supplied through KEMSA. We have agreed to subsidize this project going through to 2018 so that we do not shock the exchequers at the counties and allow a logical transition of this cost to the counties. So for now, we plan to roll this out to at least 10 major towns as we go along. And just keeping in mind the underlying principle of His Excellency is that no Kenyan should be more than 1 hour away from some basic form of healthcare.